are accelerated. In terms of, we have 1,354 people that have tested positive for the disease out of a sample size of 7,732 within the last 24 hours. In terms of cumulative cases so far, we have 118,889 cases. We've been able to disaggregate this for you. 1,301 are 719 are males, 635 are females. The youngest is a 7-month-old infant, while the oldest is 100. Provide you with a distribution by county. Nairobi continues to lead with 717 cases, Nakuru having 174. We've been able to provide a disaggregation of all the counties by sub-county, the number of cases. On a positive note, 185 patients have recovered from the disease, 136 isolation, whereas 49 from various health facilities. Our total recoveries stand at 89,388, and we continue to thank our healthcare workers for their continued dedication to duty, which has enabled us to receive and achieve these results, amongst others. With regard to the vaccination exercise, a total of 300,500 doses have been distributed in 10 regional stores countrywide, including the military, from a total allocation of close to 530,000 doses. The regional stores include Eldoret, Garissa, Kakamega, Kisumu, Mandera, Meru, Mombasa, Nairobi, Nakuru, Nyeri, and the military. As of today, we've been able to vaccinate 28,255 healthcare workers, teachers, security personnel. We thank you and we welcome questions.
I've heard you saying that the vaccination exercise is following a strict in the matter of vaccination. Members from the public have received the vaccine here at MOH, and I think what is happening is there confusion. There was also a tweet by MOH welcoming the members of the public to receive the vaccine. And therefore, I think passing by here yesterday, I could see a huge number of people among health workers and the priority list, and therefore the number of people turning out are low. And therefore the government is inviting members of the public to increase that number.
First, regard from Citizen TV, a question to you, Dr. Mwangi, and I would appreciate input from Dr. Willis. Meru Governor, Kireti Murungi, was among the first governors to receive the job. That's about a week ago, and yesterday they found positive for COVID-19. And probably the question among Kenyans would be, what is the science behind it? What is the rationale? Perhaps was he positive before being vaccinated, or is it possible to be vaccinated and then turn positive as well?
The Rimalola from KTN, actually, what is with the infection numbers, what is the ministry doing to improve the human resource for health? Because what the report was saying, and those who are working there hired on 6-month contract, which ended. So where we know that.
Is that one more, or? Sorry. Great. So let me start with Zainab's question. We're experiencing hesitancy, and 2, are we following our strict priority list as evidenced yesterday? And we've repeated this on turning positive after getting the vaccine. We've insisted in the beginning and really tried to explain to members, you getting the vaccine, you getting the jab, does not mean that you cannot get COVID-19. That's one. You getting the jab, and this is very important, you receiving the jab does not mean that you cannot transmit.
How we identify those who have the health conditions and the strategies we will use to reach them. Thank you. So.
All good.
Kameme TV, Muthegi wa Rũrĩrĩ.